Hello, Dr. Arya. Good evening, ఎలా ఉన్నారు? How are
Good
you doing?
evening, Rajeshwari. I'm doing very well. Thank you so much for inviting me.
No, thanks to you. I know you have a busy schedule, and this was a very short notice that you had, and you still were very kind enough to accommodate us during this time. So, we are very happy to have you as one of our guests for the Radiothon Season 2 in Radio Surabhi. And this year, as I was telling you, our theme is marriage as an institution. We say Kalyanam Kamaniyam, terms and conditions apply. So there are so many things that go into this marriage as an institution when we say. So the primary aspect that we will be discussing with you, you being the fertility specialist, we would like to explore that area and just touch upon some, important aspects which our listeners could get benefited out of. So once again,
Absolutely.
thank you for giving us time. Um,
Always
so
happy to. This is I see this every day in office. It's like I don't need to be given a month long uh, notice about that. So happy to talk about anything about fertility.
Thank you so much. And this is also going to benefit a domestic violence shelter in Dallas. Mosaic Family Services, they support domestic violence victims, trafficking victims, and all those people and their children. So we are trying to raise funds for that cause as well. So your contribution in this way is also definitely adding value to that. So thank you again
Wonderful.
for your
What a
time.
great initiative.
Thank
Yeah.
you, ma'am. So let's start the conversation by talking about, is it really becoming that difficult these days for women to conceive?
So Rajeshwari, I think the short answer is yes. It is becoming difficult, but biology has not changed over the time, though.
Hmm.
Now the timing has changed. People
Hmm.
are delaying childbearing because of
Hmm.
different reasons.
Hmm.
Career is the one major one,
Hmm.
and equal rights is the other one. So we as
Hmm.
women, we want to be professionally sound also before we start building the family.
Yeah.
And and women's age plays the major role.
Hmm.
Of course, the men's as well, but
Hmm.
us contributes more to that difficulty if we are delaying it.
Hmm.
And so it has become harder. Fertility problems have become so much more common now. One in every five or one in six couple is struggling. And that number
Wow.
changes based on what age group that you're looking at. But
Hmm.
that's average. And if you break down the age groups and you're looking at 35 and older,
Hmm.
then you probably are looking at much higher frequency.
Wow. And 1 in 6, you say?
One in six is the average.
Wow. Okay. So we hear a lot about this fertility crisis. Is
Mhm.
that something that we can say that we can be contributing to what you are suggesting, like, the delayed marriages, or could be awareness as well?
Yeah, so I probably would avoid using the word fertility crisis
Hmm.
because we are a lot of, so nowadays the fertility is delayed or childbearing is delayed, and that's a lot of that is intentional because we are in our mid 20s and early 20s, we are focused on career.
Yeah.
And then we are in 30s when we start thinking about family building. So
Hmm.
it's intentional to some extent. So at the same time, if you're aware about it, then we can take actions. We're
True.
not able to reverse the biology, there's no way, but we can take some planning ahead of the time
Hmm.
and protect it or prevent some of the problems that may occur later.
Nice. So you mentioned about, like, the age right now, right? The early 20s, how we are focused on the career. So how much impact truly does age have on women? And is there also a similar biological clock for men?
So age has impact on both men and women,
Hmm.
but on men it's a little bit later and it's a bit more gradual. For women, it affects us a bit earlier because we women are born with the fixed number of the egg that
Hmm.
are not going to regenerate and they are going to decline over the time in their numbers and the quality. So, how well they do in terms of turning that egg cell into the embryo and into the baby, that goes
Hmm.
down with time.
Hmm.
So, it's affecting both, but us a little bit disproportionately more.
I see. So what do you recommend as a, like, right age for
To
planning?
have a child, that answer is very subjective.
Mm.
However, if you ask what's the best time or what's the easiest time to have a pregnancy out of
Mm.
different age range, that's going to be mid 20s.
Mid 20s.
Mid
Okay.
20s. But that depends on where we are in our career and education and stability and partnership and marriage. So if there is a delay beyond that, and then I typically say that at least get some evaluation done. Know
Mm.
your basic health, know your fertility health, what your
Mm.
cycles are doing, what your egg reserve is looking like, and
Mm.
take a bit control for the things that you can.
Mm.
And fertility preservation is such a beautiful technological advancement nowadays that we have. So
Mm.
that it's not going to guarantee, however, there's very high reassurance that when we do the fertility preservation in our mid 20s and we are in our mid 30s, at that time we are having struggle, it's so much easier to conceive with those cryopreserved embryos or egg cell.
Okay, so when you say fertility preservation, you're talking essentially about preserving the eggs?
Egg cells, eggs or sperm or embryos, depending on the joint venture, as
Mm.
if you're married and you see
Yeah,
yourself to be together for rest of the
yeah,
life. Or
yeah,
you
yeah,
want to
yeah.
have the autonomy and I want to have full control on my egg.
Yeah.
So it depends on the individual.
Wow. I mean, medical advancements, technology advancements have really redefined life
Mhm.
to a larger extent to everybody today. While it seems very, oh, that's a great option, sort of a thought process may come, but also there's so much complication that, comes along with it, right?
Right.
So would there be anything that people have to be mindful about when they're thinking about the fertility preservation?
So fertility preservation is first thing is that mindset. It does not guarantee. So I tell my patients that do not rely this as your absolute 100% answer later on.
Mm.
So whenever you are socially and the career wise, whenever you're ready to start building family, work on that. But that's your backup. And if you're having difficulty conceiving, let's say you froze your egg at age 28 and now
Mm.
you're 33 and you have a partner, you're trying to have a baby now, you spend maybe 6 months trying on your own. And if
Mm.
it's not helping, then go back and say that, can I use those eggs? And that can be a great source there. So
Mm.
I don't want that as a guaranteed that you forget about everything else. Of course, still committing to optimizing your health throughout. That's very important.
Mm.
And you still need a healthy body to raise the baby.
Yes,
You have cryopreserved the egg, but your uterus in your body still remains.
yes,
Focusing on the general health in like kind of a holistic approach that
yes,
sleep well, eat good, lifestyle is a big factor nowadays.
yes, yes.
Yeah. So
No, I see.
timing and lifestyle are the two major things that are contributing to the decline in fertility.
I see.
Mhm.
So, taking a little step back here, right? Like we were discussing, people nowadays are women, especially as we started this conversation, you also mentioned that women are nowadays giving higher priority to their career, their stability, financial stability, and everything, even before they enter into such huge commitment in their life, because definitely it's a life changing thing for a woman, especially. Correct. So, let's say somebody in their is getting married in their late 30s, and if in their late 20s they think about all these consequences because of the late marriage and then having problems with conceiving later on in this life. So if they think of, I mean, I don't know if that's a common thing that is happening today. Do women do that now, like in their late 20s or early 20s? They just, they check on their fertility health and they preserve the eggs, and then they later on get married, and then does it happen? Is that something?
No, it is not. And unfortunately, it's a huge gap in the awareness. And
Mm.
I had doctor patients who would come in their late 30s thinking that I'm ready to have a family now. I was like,
Mm.
my friend, your egg reserve is very low now, so we'll give our best effort.
Mm.
But the treatment helps quite a bit. It's such a
Mm,
high rate of the success nowadays, and
mm,
if done right, then we do expect good outcome. But
mm,
you cannot reverse age effect completely.
mm,
So awareness is not there. Like you think about general population is absolutely not there. Women are not aware, men are not aware.
mm,
And even medical doctors who are not in the field of reproduction or fertility are not really familiar with how the age affect because and part of that is contribution from social media
mm,
and a lot of celebrities not showing up this full story.
mm.
But those news that comes out that she was
Yeah.
45 and she had first child, so people think that, oh yeah, it's like natural, you get it, when
Yeah.
you want it. It's
Yeah,
not
yeah. They
that
don't know
easy.
the story behind. Yeah.
Right, but did she use the donor egg or did she cryopreserve her egg? We don't know.
Yeah, and earlier, I mean, couple of months ago, Upasana Kamnini, she made a statement about preserving eggs, and then that went really in all directions, and people started, a lot of backlash came, right?
Mhm.
So,
Right.
like you said, maybe the awareness is the issue, and some certain topics are still taboo, unfortunately, and people don't want to, accept the realities as they are. So, can we talk a little bit about alternate options? Let's say people have to go through those kind of things these days, right? What are the options they have? What are the safe choices?
So safe choices for talking about the fertility preservation as a treatment or
No, I'm talking
option.
about conceiving. So we
Got
spoke
it.
about the
Uh-huh.
time that they can get they pregnant or the right age for pregnancy, or they're planning late child, then they can preserve, we can do the fertility preservation and all that. Now I want to talk about what if they have to go for
Go through a
alternate
treatment,
options.
right? So, Rajeshwari, the first thing is that you want to have a well thorough testing to
Mm,
assess what are those parameters that should be in the normal condition for a
mm,
conception to occur.
mm,
And after that, then it's a targeted treatment based on those. So, for example, the very basic key test that I typically recommend for my patient is know if your fallopian tubes are open or not, know if your egg reserve is good or not. And it's a simple blood test and an ultrasound to know that. For the first one, it's a simple HSG test. And then the last one is the sperm analysis. And if you have everything all good, then beautiful. And then it depends on what your age is, and women's age plays a big role there. So
mm,
if someone is 35 and trying for 6 months and all these factors comes back to be normal, then the immediate next option I typically go by,
mm,
what is your desire? How many children do you want to have?
mm,
Someone say that I want to have a family of 4 children, that's going to be a different treatment compared to just like I'm good if I have one or two.
mm,
Then I start with the easy treatment like intrauterine insemination,
mm,
where we give medication for women to have more than one egg to release in that month cycle.
mm,
And insemination is where her husband's sperm is prepared in a way that its clean motile sperm is placed in the uterus. So now we are enhancing the chance of a natural conception still occurring in her body, but
mm,
increase that probability to occur.
mm,
So that's the easiest treatment. The chances of that success goes down as we get older because the egg quality becomes a problem.
mm,
So if I start on those treatment, then I don't want them to keep going on it forever. We
mm,
define a timeline that for these 3 to 4 months, we will month to month, we will give our best try.
mm.
If not pregnant, then IVF is the other alternate.
Mm.
And that
So
has much
before,
better
I'm sorry
success.
to interrupt you here. Before
Yeah.
we switch to IVF, for
Mhm.
this process, you said that the older the women gets, the difficult it is, right? So what about the men's age at that time?
So men's age plays a role, and there is a little bit of the blurring in the line that as the men age is 45 and older, that's where their sperm numbers are affected. However, you have to take it with a grain of salt. If you have a metabolic condition, obesity, low testosterone, and sperm problems, then age doesn't have that, like you're not going to just blame on the age. There
Mm,
are much younger men who were not aware about using the testosterone in their young age and they used it for libido or some other reasons, and or their primary care doctors many times were not aware that testosterone will kill their sperm.
Mm.
Now that has affected their sperm quality so worse that it's not reversible many times.
I see.
So age is the factor for guys, but also their general health is very, very important. And in my clinic, I treat both of them as like you are equal contributor to the process. No.
Right, right. And how much awareness about this does the Indian community have,
It is
especially?
not very, very low. And you see first time, and there's a lot of hesitation also because I think don't want to generalize, but many time in our communities we think that it's women's is the who is carrying the
Yes.
pregnancies. It's her is deciding the health of a pregnancy. So there is, as we are definitely much more educated compared to general
Mm.
baseline population, but this information and awareness is still quite lacking.
Mm. Yeah, figured as much. Okay, so let's now talk about IVF, doctor.
Mhm. So IVF is the treatment that either when we have everything in perfect shape and IUI treatment does not work, or after fixing whatever or helping with the ailments that were there. For example, if somebody had ovulation problems and I fixed that and still not able to conceive, and IUI did not help, then IVF is the treatment. Or for some patient, that is as a first line treatment. So someone who had tubes that are not functional, the fallopian tubes are blocked, or her husband has very low sperm numbers,
Mm.
very low concentration motility, or any of the important parameters of the sperm analysis,
Mm.
then IVF is the only option for many. And
Mm.
other reasons are for those when they have genetic problems in the family.
Mm.
Like sickle cell disease, thalassemia is common in our ethnicity.
Mm.
That's one. Sometimes diabetes can be genetic.
Mm.
And by doing the IVF, I can select the embryo that we can eliminate that problem almost.
Mm.
So similarly, there are some others. I do see those patients for embryo biopsy testing, and they are doing IVF mainly to reduce their genetic risk exposure to their next generation.
Mm. I
That's when
see.
we do IVF. Yeah.
I see. So, are there any, adverse effects with either of these options?
With IUI treatments, no, there are not because conception is natural. However, there is a small risk of twin pregnancy with that.
Mm. Mm.
And patients sometimes say that, why do you call this as a risk? I
Yeah.
say that we want a single baby at a time. You
Yeah.
can have another one a year and a half or 2 years later.
Yeah.
But that's not a huge risk if you're controlling the ovarian stimulation, some medication when you use for the IUI,
Mm.
if the doctor is very careful on how much to prescribe and when to do the IUI. So sometime if I have patients who have very high egg numbers available in the IUI cycle,
Mm.
I don't do the IUI in that. We cancel it. So we can control that risk of twin pregnancy.
I see. I see.
And with IVF, the risk is it's a medical procedure. However, it's a very low risk procedure if it's done right.
Mm.
And the right dosing of the medication is used for the woman. And the procedure is done safely with proper anesthesia and proper techniques. It's a very low risk procedure. Touchwood never had any trouble. And majority of the time, the risk is less than 2%.
I see. That's good
Yeah.
to know.
Mhm.
Can we talk a little bit about surrogacy?
Yes,
So,
absolutely.
how common is it in the Indian community and especially here in the US?
Mhm. So, Rajeshwari surrogacy or gestational carrier is the right word nowadays
Mm.
because traditionally surrogacy was where the woman with her egg and she will be carrying the baby out. So, was
Mm.
the definition of surrogacy.
Mm-hmm.
It's illegal now.
I see.
You can have a person serve as a gestational carrier using someone else's egg, though. So there is a disconnect between the uterus and whose biological the tissue is that, basically.
I see. Mm.
And that helps to minimize or almost eliminate the legal problems then.
Mm.
So there is a legal contract on all those things they work on that she will be carrying the pregnancy, but it's not her biological.
Mm.
It is not a common approach in Indian population usually.
Mm.
It tends to be very tedious to find the right gestational carrier.
Mm.
It is very expensive. So
Mm-hmm.
on an average here, with the agency cost and finding and supporting their entire pregnancy and paying to the gestational carrier, it's about 150K.
Oh, wow.
Huge cost.
Mm-hmm.
And then selecting and screening for the right gestational carrier is a big concern also.
I see.
But it works for patients, and sometimes people need that if
Mm.
the risk of during pregnancy is excessively high, that
Mm.
they can have serious consequences from conceiving,
Mm.
or someone who had a problem with the uterus that they're not able to carry the pregnancy.
Right.
Yeah.
It could be some health related
Right. Yeah.
connections. Yeah,
Mhm.
that is great. Great. That's a lot of information, and I'm sure it'll take some time to sink in everything. But one last question before I let you go will be: we discussed about few of the issues that men might have in terms of women, the wife to conceive. What are the major concerns or major issues that you have seen in your experience, especially with regards to Indian men uh,
Mhm.
in this process? Because everybody talk about women issues and that, but I would like to know from you, what about the man's side?
Got it. Rajeshwari, fortunately, I have not had much issue. They're very acceptable to the testing, and
Mm,
they're very acceptable to reach out for the appropriate treatment whenever there
mm,
is concern.
mhm,
But I think because of the awareness, they delay the testing for quite a bit of the time.
mhm,
And unless they hit to a fertility clinic, they don't do the sperm analysis until like they've been trying for several years.
mm,
And one major thing in our community is that they keep trying for many years, many time. I have so many patients that tried for 6 years and 8 years and still no conception. And they come to me by this time they're 42 or 41.
mm,
So that's the big factor.
mm.
But usually they are very accepting to, okay, this is where I'm standing and this is what my next steps are. And they're very supportive to their partners also.
So what kind of issues they may have additional to
The
what?
issues, so a lot of that is the metabolic health.
Mm,
I do diagnose a lot of the my patient's husband with diabetes, and
mm,
that starts from the sperm testing. So the sperm health is kind of I say that that's your mirror of your health a lot of the time.
mm,
If that comes abnormal, then I usually start all the testing parallelly. Look for the diabetes, and many times that's that, and then when I do the sperm analysis, that's also abnormal. So it's like I suspected that.
mm.
So diabetes, hypertension that's uncontrolled, and many times they think that I can do this exercise and breathing. They're all helpful. Definitely we should. But if you need the medicated treatment for hypertension, diabetes, then do that.
Mm,
Obesity
mm,
and stress and lifestyle. We are all A+1. Like we just want to be perfectionist in everything.
yeah.
And compromising on the sleep is the big problem then.
Mm, right.
So, and I think our body is not, uh, Indian ethnicity is very predisposed to diabetes and metabolic health problems.
Mm,
And when we land in this country, when we have access to a lot of more processed food that our genetics don't allow us to process that very well, then it's like the double problem.
yeah, definitely.
So that's how Indian community has much more cardiovascular problems than any other ethnicity.
Mm,
Yeah. So insulin resistance, diabetes, all of those problems are huge.
yeah.
Mhm.
Thank you so much, Dr. Arya. It is very, very helpful. Like I said, this much information takes time to sink in, but we hope to have a very elaborate conversation with you sometime soon. But we really appreciate your time. Thank you so much for joining us
Yes,
today.
it was such a pleasure, Rajeshwari. Thank you so much
Thank
for
you.
inviting me. Take care.